Good morning, students. We are studying about childhood disorder space, especially for nursing students. The first question is autism spectrum disorder is primarily characterized by options are option A hallucination, option B impaired social interaction and communication, option C excessive speech, option D aggressive. Autism spectrum disorder is primarily characterized by the impaired social interaction and communication. The answer is option B. Okay. Then next comes to this option B. The next question number 2. The classic trait of ADHD includes ADHD means attention deficit hyperactivity disorder. The options are option A anxiety, restlessness, fear, option B hyperactivity, impulsivity, inattention, option C mood swings, hallucination, sleep disturbance, option D aggressive, depression, withdrawal. The classical trait feature of ADHD is the child is hyperactive, highly impulsive, and inattention. The child is increased psychomotor activity, that is called hyperactive, and highly impulsive. The child can't control their impulses, and the child is highly distractible, means inattention. The option B is the right answer. Okay. Next, question number 3. Aneurysm is diagnosed when bedwetting occurs. Aneurysm is diagnosed when bedwetting occurs. Option A, before 3 years of age. Option B, after 5 years of age. Option C, at any age. Option D, only in daytime. The meaning of aneurysm is the child is doing the bedwetting during the night time. Usually, the child is doing bedwetting at the age of 5 years of age. After 5 years of age, if the child is doing bedwetting, then it is diagnosed as an aneurysm. The option B is the right answer. This is option B is the right answer. Next, question number 4. Conduct disorder is most often associated with options A, aggressive, rule-breaking. Option A, aggressive, rule-breaking behavior. Option B, suppression anxiety. Option C, intellectual disability. Option D, ritualistic hand washing. Conduct disorder is most often associated, means conduct disorder is always associated with always working with the aggressive and rule-breaking behavior. The child who is having highly aggressive and rule-breaking behavior, that child is always associated having the conduct disorder. Not a suppression anxiety, okay? Not suppression anxiety, not a intellectual disability, not a ritualistic hand washing. Ritualistic hand washing is called as OCD, okay? OCD, it is called as a OCD. The right answer is aggressive and rule-breaking behavior. Next, question number 5. Oppositional defiant disorder differs from conduct disorder by absence of oppositional defiant disorder differs from conduct disorder by absence of, options are argumentative behavior, option B physical aggression and cruelty, option C defiance of authority, option D irritability. Where oppositional defiant disorder differs from conduct disorder by absence of physical aggression and cruelty. There is no physical aggression and cruelty in a oppositional defiant disorder. Whereas conduct disorder, the child is having highly aggressive and highly cruel behavior. Your right answer is option B. The child doesn't have any argumentative behavior in oppositional defiant disorder. When deficiency of authority also the child don't have, and irritability is not having the oppositional defiant disorder. Next comes to question number 6. A child who cries excessively when mother leaves from work beyond age 3 may have. A child who cries excessively when mother leaves from work beyond age 3 may have. Options are depression, option B ADHD, option C separation anxiety disorder, option D autism. A child who cries excessively when mother leaves from work beyond age 3 may have a separation anxiety disorder. This is the answer of question number 6. Whereas depression we cannot see, ADHD we can't see, the autism not. This is a definition of separation anxiety disorder. The child is crying even though beyond the age of 3 when mother is leaving for work, then it is called as separation anxiety disorder. Then now question number 7. Dyslexia is a disorder of. Next question is dyslexia is a disorder of option A writing, option B reading, option C arithmetic, option D motor skills. Dyslexia is a disorder of reading. Dyslexia is a disorder of reading. Okay. Dyslexia is a disorder of reading. Next comes to, it is not writing, not arithmetic, not a motor skill. Dyslexia, see, it is one kind of learning disorder where the child is unable to read properly. Okay.